Imagine you are working a 12-hour shift in like a sweltering commercial kitchen.
Mhm.
You know, the ovens are blasting, the air is just thick with humidity, and you are moving constantly over slick floors.
Oh, absolutely exhausting.
Right. Or, I mean, on the flip side, imagine you are pulling heavy inventory in a freezing cold storage warehouse, the kind where you can literally see your breath the second you walk in.
Right, or even doing outdoor field work in a heavy hazmat suit under the summer sun.
Yes, exactly. Now imagine trying to do any of those highly demanding jobs while your body's internal thermostat is just completely, utterly malfunctioning.
It is a recipe for absolute physiological chaos.
Yeah,
I mean, we walk around expecting our bodies to naturally adapt to our environments.
right.
But when that internal baseline is broken, the environment stops being just a background detail. It essentially becomes a weapon against the nervous system.
Welcome to today's deep dive. We are looking at a really fascinating stack of medical data today. We have got endocrinology journals, workplace health and safety regulations, and clinical consensus guidelines.
It's a lot of ground to cover, yeah.
It really is. And our mission today is to explore the biological mechanics of vasomotor symptoms. Basically, what most of us know as hot flushes and cold flashes.
Right.
But we're looking at this through a highly specific, very critical lens. How does working in extreme temperature environments completely distort the tracking, the reporting, and the actual biological experience of these symptoms? Like, if your job is hijacking your biology, how do you even begin to untangle the medical data?
Well, to even begin to untangle that, I mean, we have to look at the raw numbers of what is actually happening in the brain. The biological root of vasomotor symptoms starts in the hypothalamus.
Which is basically the brain's temperature control center, right?
Exactly. So in a typical premenopausal state, the human body operates with a thermoneutral zone.
Okay.
Think of it as a temperature buffer of about zero point 0.4 degrees Celsius. It is a tiny but vital window where your core body temperature can fluctuate slightly and your body doesn't need to take any action.
So you don't sweat to cool down and you don't shiver to warm up.
Right, exactly.
Okay, let's unpack this buffer zone for a second. It is kind of like having a forgiving smart thermostat in your house.
Oh, I like that.
Yeah, like you set it to 70 degrees, and it lets the house drift to maybe 71 or 69 before it quietly kicks on the AC or the furnace. It doesn't just panic over every tiny draft.
That is a perfect analogy.
Yeah.
But the thing is, during the menopausal transition, that smart thermostat just completely breaks down.
Wow.
Yeah, the medical data shows that the zero point 0.4 degree buffer zone shrinks down to virtually zero point 0.0 degrees Celsius. The safety net just vanishes.
Wait a second. I need to push back on that. Why would a reproductive hormone like estrogen have literally anything to do with the temperature dial in the brain?
That is such a common question.
Because I think a lot of people, assume menopause is strictly a reproductive system event, not a neurological one.
Right, and that is probably the biggest misconception about this entire biological process. Estrogen is not just a reproductive hormone. It is a highly potent neuromodulator.
Okay, what does that mean in this context?
Well, it is fundamentally involved in regulating the expression of neurotransmitters in your brain, specifically things like serotonin and norepinephrine.
Oh, okay.
So when estrogen levels decline, the sympathetic nervous system, which controls our fight or flight response, it basically loses its primary stabilizing force.
So the brain's chemical signaling essentially just goes haywire without estrogen there to keep the peace?
Precisely. We see this mediated heavily through what are called alpha-2 adrenergic receptors.
That sounds complicated.
It does, but without getting bogged down in the deep chemistry. Just think of these receptors as the cellular alarm system for heat. Without estrogen regulating them, they become hypersensitive.
Okay, I'm following.
So a tiny, completely normal fluctuation in core body temperature, say from drinking a hot cup of coffee or just walking up a flight of stairs.
Right.
That tiny change hits that newly narrowed zero point 0.0 degree zone. And because the buffer is gone, the hypothalamus panics. It interprets a tiny temperature drift as a catastrophic overheating event.
Oh, wow. So a hot flush isn't the body spontaneously generating a massive fire inside. It is actually an exaggerated panic response to a tiny spark.
Yes, exactly. The hypothalamus triggers extreme peripheral vasodilation.
Which means what exactly?
It is forcing blood to rush to the skin surface, and it initiates profuse, heavy sweating. The body is desperately trying to dump heat that isn't actually harming it.
Just because the alarm system is hypersensitive.
Exactly.
Man, here is where the workplace reality crashes into this biology. Because, you take that neurological reality. a vanished thermoneutral zone, and an alarm system set to a hair trigger,
Right.
and you place that person into an extreme work environment. If that buffer zone is essentially zero point 0 degrees, suddenly the ambient temperature in the room isn't just uncomfortable. It is a massive, disproportionate biological trigger.
Oh, the environment acts as a severe amplifier. We connect this to the bigger picture. A hot commercial bakery or a sweltering foundry is not the root cause of menopause.
Right, the hormonal shift is the cause.
Exactly. But radiant heat, the intense heat coming off an industrial oven or heavy machinery, it is particularly brutal.
Because it pushes them over the edge.
Yes, it instantly pushes the worker's core temperature past that fragile, lowered upper sweating threshold. The body literally cannot physically tolerate the room.
But wait, it's not just the temperature of the room. A huge focus in the occupational health data is on what the worker's actually wearing, right?
Oh, absolutely. Personal protective equipment, or PPE.
Yeah, let's go back to that worker doing asbestos removal or handling hazardous chemicals. They are in a vapor impermeable suit. These suits are entirely non-breathable by design, to keep toxins out.
Right, but that means nothing can get out either.
Exactly. Here's where it gets really interesting. That uniform basically traps a woman in her own microclimate.
And that creates a highly dangerous physiological trap. You see, the human body's primary, almost exclusive method of cooling itself down in high heat is evaporative cooling.
Sweating.
Right. We sweat. The sweat evaporates off our skin into the air, and that phase change pulls heat away from the body.
Okay.
But inside a non-breathable hazmat suit, the local humidity skyrockets. According to workplace health regulations, when ambient humidity crosses 80%, sweat can no longer evaporate.
Wow. Because the air is simply too saturated to absorb it.
Precisely.
So the hypothalamus panics and triggers a hot flush. The body pumps out massive amounts of sweat to cool down, but the sweat just sits there.
Yeah.
It is trapped against the skin under a synthetic suit.
Which means the core temperature doesn't actually drop. The brain senses that the cooling mechanism failed, so what does it do?
It sweats more.
Yes, it signals the body to sweat even more. This leads to rapid, dangerous heat stress and severe dehydration without ever achieving the goal of actually cooling down.
One of the occupational health reports brilliantly describes this as a double heat wave. You have the internal menopausal heat wave colliding head-on with an external environmental one.
It is a perfect storm.
And that has to destroy cognitive function, right? I mean, when your brain is screaming that you are overheating, you cannot safely focus on a complex task.
Oh, the cognitive load is immense. Heart rate spikes, blood pressure fluctuates, dizziness sets in, and concentration just plummets.
And in an industrial setting, a lapse in concentration isn't just annoying, it is a severe safety hazard.
Absolutely.
Okay, so I am following the logic on extreme heat. But I have to stop you here because the clinical guidelines also heavily feature something called cold flashes.
Yes, they do.
And frankly, this seems totally counterintuitive. If the body's buffer zone is gone and it's constantly panicking about overheating, why on earth would a worker experience a violent shivering fit?
I know, it sounds like a complete contradiction. But it is actually the exact same hypothalamic instability at work.
Really?
Yeah, remember the thermostat is completely broken. It doesn't just overreact to heat, it overreacts to cooling.
Wait, so the body is essentially overcorrecting. Like, it tries so hard to cool down from a hot flush that it accidentally throws the person into a freezing shivering fit.
Yes. Let's look at the mechanics of it. When a hot flush triggers that massive vasodilation and heavy sweating, the body rapidly dumps heat.
Okay.
But in a menopausal state, the lower shivering threshold, the temperature point at which your body decides it needs to shiver to generate heat, is actually elevated.
Oh, wow.
So as the body aggressively cools itself down from the hot flush, it hits that new, higher shivering threshold incredibly fast.
Man, I need an analogy for this because the biology is just wild. It is like driving down the highway, realizing you're going a little too fast, but instead of gently tapping the brakes, you completely panic and throw the transmission into reverse.
That is exactly the mechanism. It is a biological overcorrection.
That sounds awful.
It is. The brain suddenly perceives that the core temperature has plummeted too far, and it literally thinks the body is freezing to death.
Wow.
This triggers bone-deep chills and violent, uncontrollable shivering that can last up to 20 minutes.
Now place that overcorrection into an extreme work environment. Like imagine you are working in a cold storage facility handling frozen goods, or even just a standard heavily air-conditioned office building.
Right.
If you just had a hot flush, You might be wearing damp, sweaty clothes. The air conditioning hits that damp clothing, rapidly accelerating the cooling process,
Yep.
and it just shoves you right past that elevated shivering threshold.
And just like the extreme heat in the bakery, the extreme cold in the warehouse acts as an amplifier. The environmental temperature masks the biological reality.
Making the body's overcorrection far more severe than it would be in a moderate climate.
Exactly.
Which brings us to the core mission of today's deep dive. We have established that the body is biologically volatile, and the workplace is amplifying that volatility.
Very much so.
So what does this all mean? If you are a listener trying to give your doctor accurate data to get the right medical treatment, how on earth do you separate your biology from your job?
It is incredibly difficult.
Because medical professionals heavily rely on what are called symptom diaries. They ask patients to track their symptoms over a month, rate the intensity on a scale of 1 to 10, and tally the frequency.
And this is where extreme work environments completely scramble the medical data.
How so?
Well, the standard symptom diary just asks, how many severe hot flushes did you have today? Let's look at our foundry worker. She diligently fills out her diary and logs 15 severe level 10 hot flushes a day.
Okay, so she takes that diary to her doctor. The doctor looks at a sheet of paper showing 15 severe episodes a day and assumes her internal hormonal instability is absolutely off the charts.
Exactly. The physician only sees the biological output, not the environmental input.
Right.
How many of those 15 flushes were spontaneous baseline hormonal events? And how many were artificially triggered simply because she walked past a 400-degree radiant heat source with a 0.0-degree thermoneutral zone?
It is basically impossible to tell from a simple tally mark.
Completely impossible.
And what are the real-world consequences of that distorted data? The clinical guidelines talk about treatments. Hormone replacement therapy is common, but doctors also frequently prescribe non-hormonal medications.
Like SSRI antidepressants or a nerve medication called gabapentin?
Right, and this is where the tracking distortion becomes a serious medical issue. Why do doctors prescribe nerve pain medication or antidepressants for a temperature issue?
Because, as we discussed earlier, the hypothalamus relies on neurotransmitters like serotonin.
Oh, right.
SSRIs and gabapentin alter the brain's chemical signaling, essentially attempting to manually stabilize that broken thermostat and widen the buffer zone back out.
But wait, if the doctor thinks the problem is 100% internal because of the distorted diary, they might prescribe a massive dose of gabapentin.
And that leads patients to chase the wrong fix entirely.
Yeah.
A woman might seek higher and higher doses of systemic brain-altering medication, dealing with all the associated side effects, thinking her hormones are wildly uncontrollable.
When, in reality, a massive portion of her symptom severity is purely environmental.
Exactly. The medication is trying to stabilize a subtle chemical imbalance in the brain, but it absolutely cannot override the physical reality of standing next to an industrial furnace.
Right, the pills won't fix the ambient heat.
No, they will not.
Conversely, the worker in the freezing environment might drastically underreport her hot flushes because the ambient cold of the warehouse is constantly suppressing them.
Yes.
But she might overreport severe cold flashes and debilitating joint stiffness, so her doctor might send her to a rheumatologist for joint pain, completely missing the underlying vasomotor instability.
What is fascinating here is that the standard tracking methods fail because they treat the patient as if they exist in a vacuum.
Right.
Just counting episodes is biologically meaningless if you don't account for the environment pulling the trigger.
So how do we fix the tracking? I mean, we can't just tell people to quit their jobs or suffer in silence. What is the actual strategy here?
The clinical consensus advises shifting the goal. Stop trying to perfectly predict or tally every single biological flush. Instead, look for clustering.
Clustering?
Yeah, you have to track the environmental conditions, the physical exertion level, and the clothing directly alongside the symptom.
That changes the conversation with the doctor entirely.
It really does.
Because it goes from, I had 10 severe hot flushes today to, I had 10 hot flushes today, but 8 of them happened specifically when I was wearing my heavy uniform in the unventilated prep kitchen, and only 2 happened when I was at home.
Exactly. That is actionable data. That data reveals the burden.
Okay.
It shows the doctor exactly how much the biological symptoms overlap with the workplace environment to disrupt daily function. And more importantly, it shows that throwing high doses of medication at the problem isn't always the primary solution. Modifying the environment is.
But if tracking is fundamentally broken by these extreme environments, we can't just wait months for a symptom diary to yield perfect data. What do we do to protect that worker today?
Well, the occupational health regulations emphasize tactical, immediate interventions.
Okay.
Since the internal thermostat is compromised, we have to rely on external thermostats.
Which means what exactly?
And to be clear, these workplace adjustments aren't just special perks or luxurious comforts. They are vital physiological accommodations for a temporary neurological hypersensitivity.
Yeah, the sources outline a few major ones. Evaporative cooling fans stationed directly at workstations, flexible dress codes that allow for breathable, natural fabrics.
Job rotation is huge, too.
Oh, yeah. Simply allowing an employee to move away from a radiant heat source to a cooler part of the facility for a portion of their shift to let their core temperature reset.
We also see high efficacy in cold therapy interventions. Immediate application of cold compresses to the neck, using cooling vests under PPE or applying cooling gels to the skin.
How does a cold vest actually stop the flush, though? I mean, is it just masking the heat or is it changing the biology?
This raises an important question about how we treat this. It is actually actively tricking the hypothalamus. Yeah. Remember, the brain panicked because the skin temperature rose slightly. By rapidly applying cold to the skin, you set a massive, immediate sensory signal back to the brain that the overheating crisis has been averted.
Oh, wow.
It forces the body's temperature back into that tiny zero point zero degree thermoneutral zone, which can drastically reduce the severity and the duration of the biological flush.
Which is an incredibly powerful non-pharmacological tool. But let's look at the long-term biological outlook. I mean, this absolute chaos of 0-degree buffer zones, double heat waves, and freezing overcorrections, this isn't a permanent state, right?
No, it is not.
Because the medical literature discusses brain adaptation.
Yes, the long-term news is overwhelmingly positive. The nervous system does not stay broken forever.
Thank goodness.
Over time, the brain slowly adapts to the new, lower estrogen state. It recalibrates its neurotransmitters.
How long does that take?
The timeline varies wildly from person to person. It can be a few years for some, longer for others, but eventually that thermoneutral zone widens back out. The hypersensitivity fades, the alarm system quiets down, and normal temperature regulation is restored.
So the extreme tracking headaches and the workplace microclimates are a finite chapter.
Exactly.
But until that adaptation happens, knowing the mechanics is everything. We started deep inside the hypothalamus today, watching the thermoneutral zone vanish. We ventured out into foundries and cold storage units to see how environments act as a biological weapon, creating double heat waves and violent shivering fits.
It is a lot to navigate.
It really is.
Right.
And most importantly, we mapped out exactly why trying to track these symptoms on a basic 1 to 10 scale in an extreme job creates total diagnostic chaos, leading to potentially incorrect medical treatments.
It really highlights how dangerously disconnected our medical tracking can be from our daily reality. You cannot effectively treat the biology without comprehensively understanding the environment that biology is forced to operate in for 8 to 12 hours a day.
If you are prepping for a meeting with human resources or occupational health to advocate for better ventilation, or even just trying to make sense of your own confusing symptom diary, understanding the how and the why changes the entire narrative.
Absolutely.
It turns a source of massive confusion into a very clear, solvable equation.
A simple desktop fan or a breathable uniform can honestly bridge the gap while the brain undergoes its natural adaptation process.
But I want to leave you with a final thought to mull over, kind of expanding on a piece of climate data mentioned in our sources.
Right.
We have spent this deep dive talking about highly localized environments, a commercial kitchen, a freezing warehouse, a heavy hazmat suit, and how they hijack the body's broken thermostat. But global temperatures and ambient humidity are steadily rising due to climate change.
That is the reality we are facing.
Yeah, we are seeing more frequent, more intense, and longer-lasting global heat waves, especially in regions that historically never even needed air conditioning. So if a poorly ventilated room can completely scramble a menopausal woman's medical data and push her nervous system to the brink, how will a baseline planetary shift in temperature and humidity fundamentally alter the severity, the duration, and the medical management of menopause for the entire next generation of women? I mean, if the world's thermostat is broken, what happens to ours?